my name's Emily and I'm one of the diabetes specialist nurses working as part of the West Hampshire Community Diabetes Service. This video is about planning for pregnancy. So why is planning for pregnancy so important? Diabetes in pregnancy is associated with risks to the mother and to the developing baby from the moment of conception right through to delivery. Complications are related to higher glucose levels. Having diabetes means your baby may be at higher risk of having health issues shortly after birth, such as heart or breathing problems that require hospital care. They may also be at slightly higher risk of being born with birth defects or being stillborn. You can't avoid these risks completely, but there are lots of things you can do to reduce them. The best way to reduce the risks to you and your baby is to ensure that your diabetes is well managed before you become pregnant, so ideally a pregnancy should be planned. You should contact your diabetes specialist team who can help you manage all aspects of care and can support you to plan ahead. Firstly, use an effective contraception until you want to try for a baby, so you can be sure that you're fully prepared before becoming pregnant. Some medication can be harmful to a developing baby, so see your doctor prior to becoming pregnant to discuss if any of your medicines need to be stopped or may be changed. If you haven't done this before becoming pregnant, see your doctor as soon as you have a positive pregnancy test. Take folic acid daily to help prevent birth defects. People with diabetes require higher strength of 5 milligrams, which will need to be prescribed by your GP or your nurse, as it can't be bought over the counter. Aim for a HbA1c of less than 48 millimoles per mole. You are strongly advised not to get pregnant if your HbA1c is above this because of the associated increased risks of pregnancy complications and baby loss. Check your glucose regularly. Aim for waking glucose levels of 5 to 7 millimoles per litre, and before meals at any other time of the day, 4 to 7 millimoles per litre. Aim for 5 to 9 millimoles per litre 90 minutes after meals. Your diabetes team may individualise these targets depending on your situation. When you become pregnant, your diabetes team will discuss the glucose targets for the duration of your pregnancy. And if you're using either flash or continuous glucose monitoring, it's advised to aim for a time in range greater than 70% of the time. Aiming for lower glucose targets can increase the risk of hypoglycemia, and for some people this can change their hypo symptoms and their level of awareness. It's really important to treat any glucose less than 4 millimoles per litre as a hypo, with some fast-acting treatment followed by a longer-acting carbohydrate snack. It's important that you have a glucogen hypo kit prescribed. For more information on hypos, see our videos on hypo treatments and glucagon injections. You should always have means to check yourself for ketones, for times when you may experience a high glucose or for when you're unwell. Ensure that you have either urine or blood ketone testing strips prescribed. You can find out more information on our video, How and When to Check for Ketones. Pregnancy can make some diabetes complications worse, so it's important to have your eye screening and your kidney function checked before becoming pregnant. And finally, follow a healthy lifestyle by staying active, eating a balanced diet, stop smoking and cutting out alcohol. The good news is, by planning ahead and getting support from your GP and your diabetes team, you can reduce the risks involved, so you're more likely to enjoy a healthy pregnancy and give birth to a healthy baby.